Dr. Joseph Martin here. I'm trusting you're well today. Our topic is healing PTSD, or post-traumatic stress syndrome, or disorder as they say, and the shock and the shame that comes with all these kinds of conflicts based on external and internal circumstances. And we are going to look into how to gain or regain, in some cases, the self-confidence, the self-respect, and the self-love that comes when you do work through PTSD. Now, my qualifications for dealing with PTSD are actually quite significant and extensive. I've been born into a military family of 12 generations on my father's side, and of course on my mother's side as well. So I grew up in a family where the outfall, the actions and reactions of violence and abuse come from people who've been involved in war. In this case, it was the Second World War of the 20th century. Besides that, I've been trained as a clinical psychologist and psychotherapist and dealt over 42 years actually extensively with lots of clients who were victims of violence and abuse and suffered from extreme post-traumatic stress disorder. And that included some of my clients who survived Auschwitz, Bergen-Belsen, and some of the other Nazi concentration camps. And I had many clients, in fact, who were coming back from wars where they had been suffering extremely from the Vietnam War, some Americans who came up to Canada, and also in Central and South America in the many wars in Guatemala and in South America. And I've had some Canadian military troops who have come back from Iraq and from Afghanistan as clients and friends of mine. And so my training as a medical hypnotherapist in Milton Erickson's medical hypnotherapy, the techniques of NLP, I'm a Master International NLP Trainer's Trainer, and also all the training that one gets when one does all kinds of psychological training. Why is this important? The reason why this is important is because we have an increasing amount of stress and war and violence in the world now. We have many more of our young people and middle-aged people who are involved in wars, either as military or in other ways as journalists, who've come back. But it's not just in warfare that we have people suffering coming back to our countries with PTSD and shock. What we have is an increasing number of people who have been, unfortunately, involved in a lot of climate change events, tornadoes, hurricanes, tsunamis, all kinds of events. They've lost their homes, their food, their shelter, their jobs, their professions, their offices, all their equipment, everything. And they're either having to stay in the same place and rebuild their lives, as in the cases in, say, in Japan with the nuclear disaster there after the earthquake, or they're migrating all over the world to find work in other first and second world countries. So the massive scale, not only of the deepening complexity of people who have PTSD, but the increasing massive numbers of people who have PTSD means that this society is actually in a devolutionary stage because we do not know yet how to deal with PTSD most successfully. Witness the fact that veterans coming back to Canada or America or in any other Western or Eastern nation suffer greatly from PTSD, and it's either misdiagnosed or just pushed aside. There is no psychological training and for these individuals, men and women, and young and old, by the way. And the government seem to be lackadaisical in their awareness and also not forthcoming in the financial aspects of supporting these people to get counseling and coaching and mentoring. They need deep psychological healing and they need deep psychological counseling when they come back. In many cases, they slip through the cracks. They end up, we have examples every week of young men and women from the military or people who've come back from war-torn areas where they were raped or highly disturbed or whatever, mentally imbalanced, and they slip through the cracks and they commit suicide. If they don't deal with their issues, they can also become sociopathic and psychopathic, and we have many cases of that in America, particularly where young people go and kill people in public schools and high schools. So this is a very serious concern that we need to take quite strongly and do something about. I know many of you listening to me right now and watching this are themselves wondering what level of comfort, discomfort, and what level of healing you've regained in dealing with the shock and the shame. What do you feel when you have PTSD? Well, basically, you feel a deep sense of fear. You feel a deep sense of anxiety. It can be such an anxiety that you just have to keep moving your arms and limbs all the time. Your mind is confused, it's fractured, it can't focus. You have a hard time focusing on events or people, a hard time listening to yourself or certainly listening to other people. You have a hard time organizing your mind. Your feelings are all over the map and you have a lot of displaced and permanent anxiety just welling up within inside you. It also creates something we call survivor's guilt. Particularly if you were in the military or you were in a catastrophic weather condition or hurricane or something, and you were one of the few that survived. We have survivor's guilt, and so you feel that you're the one to blame, that the others should have lived and you didn't need to. It was why you asking God. You're asking, why am I the one that survived and how can I deal with this? It's an enormous amount of survivor's guilt. There are many other things besides this as well. You have nightmares, you have hallucinations, you find it hard to sleep, you need a lot of sleeping medication just to get to sleep. You're always on guard and on watch. Any small or loud sound can set you off and give you kind of reactive memories of things that have happened to you, particularly in military circumstances and war, which is again increasing everywhere on this planet at this time. There are so many psychological and emotional and sociological outfalls to this, and there is no safety net financially or psychologically back home. Many of your friends and family and do not understand what you've gone through. You feel extremely isolated, extremely lonely, and in fact so absolutely depressed that you don't know what to do with yourself. You try to make yourself active by starting up some work or career or day job, but you find yourself kind of zoning out during the day and you don't know where you're going and you can't concentrate on work, you can't concentrate on things. Even while driving along sometimes, you need to pull over in order to just kind of be with it and breathe, to explore and expand what is going on with these hallucinations and memories. If this continues, you will go into a downward spiral, as many of you do know. My hope and my suggestion for you, because this is a very serious issue, and sincerely I am suggesting, although I myself do no longer do this kind of counseling, you do need to seek out some very professional, moral, ethical, sensitive, caring, loving, kind, respectful psychologists or someone who's trained in dealing with PTSD and get some support right away. I would run for support. Don't wait any longer. If you've been thinking about it for a while, make the phone call, do this right away, go and find support. And part of the challenge I know from my own parents and other people that I've dealt with as clients of myself when I was a clinician and a researcher in this field, as an anthropologist and psychologist, is that, the vow of silence you take with yourself is going to kill you. You do need to go out and share your story. I suggest you write it down in a journal. You paint and become creative with it. You draw it out. You draw out your feelings and your emotions and your experiences and past events. This is one way to unburden yourself. Your spouse and significant others, and particularly your children, they do need to hear your story. Most people come back and they say nothing to no one. You must share your story. Be creative about it. You can put it into any form, and many people these days put it into a short story, a novel, and even a feature film or a documentary. This is what you need to do. I would highly recommend you do this, and then you can reassociate with others of your cadre who've gone through similar experiences. Seek them out or start organizations for yourselves and start talking and sharing your stories in a way that's going to be productive and supportive. And I don't mean sitting around drinking and talking to buddies and saying, things that on a very superficial level. This is not what I'm talking about. I'm talking about, getting rid of addictions before they take you down the spiral to suicide and other sociopathic kind of avenues. Be kind, respectful, gentle, supportive with yourself and your other friends. Ask for those who have not gone through this experience to sit and listen to you, support you, care for you, and ask for what you need. Ask for the emotional connection and support you need. All this needs to be done face to face. This is not good to be done on email. You need to be sitting and standing in front of somebody and feeling that human heart connection and love and support and understanding and listening. This is most essential to your own healing. There are many more things to say about this, obviously, and I've had so many thousands of cases of this, far too numerous to mention. I would suggest that you get some deep clinical hypnotherapy to unburden yourself and do what we call timeline therapy in NLP. Now, not just someone who's trained in NLP, but you need a psychologist to do this with you, where you can go back, revisit those events in past times or past lives in some cases, and clear the feel and the fearing energies around it. Clear the anxiety, clear the fear, like depotentiate the amount of emotional energy you feel around this, and that includes all the emotions and all the anxieties, whether it's sadness, shame, and guilt, or shock, or whether it's fear, or whether it's anger and rage, any of these and all of these. Depotentiate that. It would be numerous sessions on your timeline to go back and release all that pressure from the pressure cooker of your past events that created all of this. You can heal and you will heal. It's good news. I myself have done this, and I've done it with many, many, many women, men, children, and adults, and so on, who've gone through these experiences. So the good news is there is hope. You can do this. You become a stronger person for it, but you need the clarity and the strength and the courage just to continue on with it and move forward in a very holistic kind of a way. You might want to change your diet and stop drinking and stop smoking and drugging, whatever it is you do. These are only going to delay the process of healing. So good luck and all blessings on this path with you in dealing with this. There is all health and all hope available to you. It's part of your path in becoming a stronger, clearer, more determined individual. And if there's anyone that you can think of, go and ask them how they did it. We have lots of people who've done it. But just think about Nelson Mandela for 27 years in prison, being terrified and being tortured. And if he can do it, he's just like one of us. You can do it too. All love, all blessings, all gifts on your path to wholeness and healing.